So the folks who ran the kind of set the table, we will collect these forms and we'll kind of see what themes came out. We realize it's difficult in 30 minutes to kind of come up with a concrete next step, and we wanted to kind of give you some freedom to pick really what resonated most with you at the table instead of kind of forcing you into one box or the other. We'll be anxious to hear your feedback if that worked or not. But would appreciate hearing from a group or two about what you came up with. What do you think is an important priority that the Global Forum group or some subset of it could actually move forward? And so, Meg, can I pick on you to kind of kick us off? Meg? Could you kick us off and give us an example? Because I know your group actually came up with something you thought was doable. So can you share it with the group, and then I'll open up somebody else?
Yes, after much discussion, we got focused and decided to pick get the IOM workshop leadership to communicate to a wider audience the importance of engaging patients in assessment and some ways that have worked. So our who is Eric and Meg, since he already volunteered me, Patricia, Rachel, Megan, and table 4. Assembled here.
Cool.
Plus more patients, including some of the ones we had here yesterday and today. And healthcare delivery organization representatives. We had a little conversation about kind of the disconnect still between academic and delivery, and so we wanted to make sure those folks are present. And regulatory organizations. So that was who. We want on our what's called our strategy. Oh, and clinician educators, community-based clinician educators. That's on our strategy committee. We've dubbed that the strategy committee. What is needed? We want a sort of a briefing note or environmental scan related to UFOF's comments on best practices in this area. We want to send it to the strategy committee, that's us, to review those things and to draft a statement. So the strategy committee would do that. And get the IOM, Harvey in particular, to convene a consensus committee about this statement, and then to ask for resources for announcing it and operationalizing, on the theory that if we ask for both, they'll give us the resources for announcing it.
Awesome. That's a nice, audacious goal. Terrific. Who else will? Yeah, Carol, please.
So we had a prolonged gestation and then a precipitous delivery.
I love it. Go ahead.
So our strategy was to create a MOOC that would be focused on core content linked to the interprofessional competencies for the beginning and advanced novice learner, with potential audiences for learners, faculty, patients, to use in educating governing boards and accrediting bodies and so forth who don't know what IPE is. Who will implement the strategy? We thought it would be a set of professional organizations to be identified, but we already know some that would be interested. What is needed is a steering committee that's interprofessional. We would need faculty content experts, curriculum design, expertise in engaging methodologies, relationship with Coursera or another vendor. And we would also need a lead organization, somebody that would be the convener, contractor with the vendor, hold funds, and so forth. Be ambitious with the implementation, that we could have an initial planning meeting before the end of 2013, maybe even, and to begin this in 2014. The strategy would be implemented in cyberspace, but with a lead organization sort of propelling it. The strategy would be implemented. The initial steps would be a quick call for interested organizations, identification of an organization that's willing to be the lead coordinator, set up an initial meeting to sort of define this and specify it, establish an interprofessional advisory committee, and develop a relationship with a vendor.
Terrific. Wow. A lot of work.
What?
That's terrific.
Long labor.
Yeah. Yeah, Patricia.
I don't know about our gestational age here, but we have something that we came up with, and Jack thinks it's kitchen sink, so it might be. Right, Jack? I'm teasing. Our strategy really came out of groups 3 and 4, and that is engagement. First of all, we think there needs to be a a publication or some kind of recommendation that comes out of the forum that says this is a priority. Engagement of more stakeholders, primarily patients, families, communities, and also the learners, which is students and clinical faculty. Informative assessment for innovation and change in interprofessional health professions curricula. And who would implement the change? We see this at the institutional faculty and student leadership within the health professions, education and training programs. Also engaging accreditation bodies to explore this as a part of how they identify assessment. And thirdly, and these are and/ors, and seek external funding from the private sector or IOM or other groups to create this as an RFP so that it gets support for pilots. When would this strategy be implemented? We see it implemented within 2 to 3 years, with exemplars of success being highlighted along the way, initiating in 2014. Where would be all health professions, education and training programs would be open, with targeting 3 to 5 within each discipline as exemplars. And again, those would be recruited from a voluntary perspective or could be selected from the external funding from an RFP that would be more specific. How would the strategy be implemented? We would engage professional societies to increase visibility of this, the need for this at their through presentations, programs, and publications. We would obtain endorsement from accreditation leaders and site visitors who do assessments that they need to start looking for this. We would also, which I added listing, convene a consensus report on this particular approach, and then we need to have an ongoing sort of watchdog, so to speak, from the IOM Innovation Forum to look to see how this evolves going forward.
So it sounds like we have two that are a little more short term, which is great, and one that has kind of a longer lens or a horizon. So that's terrific. We have time for one more. And yeah, please.
Well, we can actually be fairly short because Meg actually said everything that we talked about, but in a much better way. We also focused on the idea of doing a gap analysis and cultivating the expertise that's existing here in the room to try to figure out where we are, where we need to go. A couple specific priority areas that we identified beyond assessment of services delivered in the healthcare settings, but also looking at how we can get assessment data to better inform decisions that boards are making, for example. And we also talked about how that feedback might feed into curriculum committees.
Yeah, I'm just struck there's other organizations that would probably be important partners like AMSA, AHA, getting to your point, you know, how, because they talk a lot with like boards of hospitals and how you could get this infused into there. And I think having a consensus statement, kind of tying it to what Meg talked about, could be very helpful. We actually have time for another one if the other two tables haven't had a chance. I know this table struggled mightily. We were kind of the outliers. Go ahead.
We scratched the surface of this topic. So we took a more of a long-term tack, looking at trying to drive evidence-based accreditation. So
Okay.
a lot of our discussion was focused on getting an understanding of how that may happen. The who will implement the strategy. We think that the data and the evidence needed will be generated by health research institutions. Hopefully some of the CMMI innovation awardees and grantees will be producing that. What is needed to implement the strategy? I think there's a consensus that there is good evidence out there that needs to be collected into maybe a meta-analysis about collaborative practice leading to better care, better patient outcomes. But there also need to be a development of better quality indicators related to team-based care, team-delivered care. When will this strategy be implemented? Folks are going to love this. It's already happening. It'll probably never be done. And but with the evolution of ACOs and the patient-centered medical home, we think that this process will be moving forward. Where will it be implemented? I mean, fundamentally, the accreditation bodies themselves are going to have to take those steps, but I think that this also touches upon the who's. How will the strategy be implemented? The professional organizations represented here can continue working in coalitions and groups such as the primary care coordinating. You all know the rest of that acronym. Will be generating some of this as well.
Great. So for those who don't know, our very own Scott Reeves has actually done several reviews on interprofessional kind of work and its impact. And I think Scott would be the first to say that we're not done doing those reviews, that'll be an ongoing process. So we do have an expert in the room that we can tap into to give us some guidance about where to go next. So thank you. I would love to ask our guests, because I know you had some great conversation. We have a mega group back here and another group was off. Do either the two groups back there want to share anything or insights or kind of key things you think we should be taking forward as you've listened the last day and a half from a strategy point of view? Did you break it, Adina? Yep, here we go. Good idea. Adina's gonna, yep, there you go.
So I was given permission to present only one of the many things we talked about, which I think we ended up with a somewhat audacious proposal that all professions should have a common licensing assessment, sort of like what the USMLE Step 2 CS might look like, you know,
Wow.
which would raise the bar. And just if we can define what good IPE practice looks like, we could sort of assess that, whatever the commonalities are across all healthcare professions in the way that, and we were talking about how we need to take that into the practice arena. One idea would be that JCO, which is a very, very powerful assessment process, might need to add something on IPE that assessed the quality of IPE and drove the organizations that we practice in to do better.
Great, thanks. It sounds like the Full Employment Act for John Norsini and David Baker. All right, so thank you very much. This is terrific, and we will collect these ideas, and it's really nice to see that even kind of in the spontaneous, somewhat chaotic process, there were some common themes that came up, and that's actually very helpful because it tells us that there is a little bit of coalescing around the room that you did kind of independently at each table. So I think that was very nice to see, plus some kind of short and long-range strategies. Here's what I'd like you to do. I'd like you to take just 3 minutes and fill out your commitment to change form. Just individually, kind of your own personal reflection time. And as you're doing that, think about what's one or two things that you really are going to take away from the last day and a half, and again, around the theme of assessment, and then we'll finish up. There's two versions, so avoid the continuity clinic and just what commitments are you going to make related to the last day. I apologize. That's what we used in a prior research project, and I revised it, but the revised one didn't get copied. So just ignore the top. With regard to your commitment to change form, we will collect those. We will enter them into a database, and then we will send yours back to you so that you can have. And we'll actually, the next forum, we'll kind of have a chance. You can kind of reflect on, between this meeting and the next workshop, what we're able to accomplish. And so, like I said, we'll do that. So, and we'll take responsibility for doing that for you. Darla and I wanted, given that we changed so many things this time around, just wanted to get about 5 minutes of feedback from you. What worked? What didn't work? What would you like to change going forward so that we can feed forward to our colleagues who are responsible for the next workshop some important lessons learned? So start with what worked about the last day and a half. Just some thoughts. Yeah, please.
Clearly, you were modeling the change we want to become in education. So I really want to give credit to the organizers for not just talking to us for a day and a half.
Okay, great. So the interaction was something that helped? Okay, great. Other thoughts? Were there any specific activities that you particularly resonated with of the different things we did? Like the World Cafe this morning, the way we ran the groups yesterday. Any thoughts about those? I see lots of heads nodding. Any specifics? Yeah, please, Sarita.
Well, one of the things I'm kind of musing about is that I think we have a matrix of a number of projects now. Things that came out of the discussions in the interest groups, and then certainly the ideas that came out from the 7 tables, the answers to the questions in the World Cafe, and now most recently, the next steps challenges that we're undertaking. And I'd like to, in my mind, I'm a clumper, not a splitter, so I'd like to sort of put that all into the hopper and see where it all maps out.
Okay.
Because I think there's some redundancy, but there's also some really interesting offshoots. And that would probably help me understand how we take collectively all of this really brilliant stuff forward to one, consensus or recommendations or whatever.
So it sounds like organizing and synthesizing where we are and kind of getting it into common sets of themes and buckets would be helpful.
Well, it's great to have the summary of the proceedings book, which is really great, and it helps me remind me what we discussed. But now I'm sort of almost thinking about a mapping exercise of the topics, the themes that have come from those various perspectives, and then doing more of a kind of a map around who's doing what and what we're taking forward, because I suspect that we're going to come up with the 4 or 5 big ideas that we've all agreed to take forward.
I feel the same thing. There's some gelling that occurs, and the question is, can we map that and kind of make it a little bit more organized? That's a very helpful suggestion. What didn't work? Suggestions for improvement. What would you change? Yeah, Jan.
If I may, at the Network Towards Unity for Health, we have developed a format for interactive poster sessions where you cluster posters and you have one animator that then makes an interaction between the authors. And because there were a lot of similarities and the same kind of topics and experiences, so having this interaction between authors and between authors and participants gives an added value, and there are very dynamic ways to do that.
Yeah,
but
that's a great suggestion.
Of course, I understand that we were already tired, but even then I think an interactive format is still better than the thing we did yesterday.
I really appreciate the suggestion. I'm just curious, did people like having the reception and the posters? Was that something that was also another new thing? Overall, kind of felt, yeah, I was actually very pleased. Thank you. I mean, I thought the attendance last night was terrific. I agree with you, it's been a long day, but I've also seen the interaction. That's a really good suggestion. Okay, great. Yeah, Patricia. You hit your mic, please.
What I thought was really helpful this time is, and I think we were better able to engage our guests by having the way that we did it in the afternoon. We didn't have just the members engaging, and I think that was helpful. And also having the patient and the student at the table, I think caused us to frame some of what we talked about differently, and we just didn't get into our own just regular jargon.
Yeah, I realize most of the students are no longer here, and we've lost some of our patients because obviously they have other things they need to do. But I want to sincerely thank all the students and patients publicly, and we really benefited from having Jeff at our table. That was just fantastic. I want to actually hear from the guest. So I know the morning didn't go real smoothly, but how did the rest of the day? Anybody want to make any comments? You give you an opportunity to respond. Adina? Not to put you on the spot. Uh-oh.
Yesterday morning, we were all sitting in the overflow room and passively watching the whole morning, including the roundtable discussion. So I think enough of us were rolling our eyes and grumbling that you quickly changed the format, which I think I appreciated the flexibility.
Right. And was today more?
And this was, yeah.
Okay,
this was
good.
much better. I think we had a chance to really interact and participate.
Well, finally, I want to thank everybody, and also please fill out your evaluation forms. And my last task is to sincerely thank the IOM staff, who are just fantastic. So let's give them a round of applause. All right. Tricia, anything else from your end?
The only thing I wanted to say was our next workshop will be May 1st and 2nd, and the topic will be community-based health professional education.
Oh, excellent. Safe travels, everybody.
Then thank you.